Are you at least 18 years of age? Do you weigh at least 110 pounds and consider yourself healthy? If you answered yes to the following questions, then you should be donating blood at least 6 times a year. Every unit you donate can help up to 3 people. The blood is separated into 3 components: red blood cells, white blood cells, and platelets. Red blood cells are used to deliver hemoglobin and oxygen to the tissues in your body and your organs. Your platelets are used to help you clot. So these are usually given to cancer patients or those who have bleeding disorders. Your white blood cells are your defense against infection. These are used also in patients who are immune compromised, those who are getting chemotherapy. I would like to share with you Bailey's story from the American Red Cross. Our daughter Bailey was 6 months old when she began showing signs of fatigue and pale color. Following a trip to the pediatrician, emergency room, hospital, and an ambulance ride to another hospital, we learned that she was severely anemic. She spent 3 days in the hospital, received 4 blood transfusions, and left with the diagnosis of diamond Blackfan anemia. DBA is a type of bone marrow disorder. Where the blood does not make its own red blood cells. The next 9 months, she received blood transfusions of packed red blood cells every 3 to 4 weeks to keep her alive. She takes chronic steroids now to stimulate her bone marrow and to make its own red blood cells, but requires blood transfusions if and when her steroid treatment is not working. Bailey is a spunky, sweet, and energized 5-year-old now. She would not be here without blood donors. We are forever grateful for those who donate blood. Thank you. What is a blood donation? Blood donation is when a person voluntarily donates their blood to help somebody else. These donors are usually not paid for their services. Why should you donate blood? Blood saves lives. 1 in 7 people admitted to the hospital will need blood. And also there's health benefits. You receive a free health checkup with every donation, and studies have shown that donating blood helps reduce the risk of heart disease, burns calories, and reduces the risk of developing cancer in the future. Blood transfusions are also used in women with complications of pregnancy, including ectopic pregnancy and before, during, and after childbirth. Those who suffer trauma, undergo surgery, and cancer patients also benefit from your donations. Who can donate blood? Anyone who's 18 to 55 years old. Men and women can both donate blood. If you weigh at least 110 pounds. Healthy people who are not pregnant, who aren't anemic, aren't undergoing chemo, and who haven't had surgery in the last 6 months can donate their blood. The donation process, the first step is registration. They need to check to see if you're eligible to donate blood. You provide your personal information, including driver's license, address, and your donor card if you have one. The second step is the mini physical. They'll ask about your health history, any medications that you're taking at this time, and if you've traveled outside of the country. Also, they may ask about your sexual history. The third step is the actual donation. This, they'll check to see if you have a good vein. Usually it's at the bend of the arm. They'll clean the site and they'll use a sterile needle. The actual blood donating, it takes about 10 minutes if it's just regular red blood cells. If you're donating platelets, it can take up to 2 hours. So it just depends on what we're donating. Once they get about a pint of blood, they'll stop the blood draw and they'll take out the needle, and then they'll just apply pressure to the site. Once they're finished drawing your blood, they'll just ask that you stay for about 10 to 15 minutes after you donate your blood, and they'll offer you some crackers and juice, and after that you're good to go. You finish donating blood. After the donation process, the blood goes to the lab and is tested for hepatitis B and C, HIV, and syphilis. Once the blood has been finished at the lab, it goes to the American Red Cross. From there, depending on where the need is, the blood will be shipped to that hospital. And then it'll be compared to see who is able to receive that blood, and then that blood will go to the patient. With this presentation, I urge you to become a regular blood donor. 1 hour is a small price to pay to help save another person's life. Imagine a loved one is hospitalized and needs blood. Naturally, we would expect the hospital to have the blood needed. However, that's not always the case. You can prevent situations from happening to your loved ones and many others by donating blood. Consider this the next time you have the chance to donate blood, because you have the ability to help the growing demand for blood in this country. Thank you.